Today we are going to simplify arterial blood gas analysis with a 6-step method, and I'll walk you through real patient scenarios that you will definitely see in clinical practice. So come on, let's do this. ABG or arterial blood gas checks for the pH, which tells us about acidity or alkalinity. It also talks about the partial pressure of carbon dioxide, which gives us a hint about the lung function. We also have the bicarbonate levels, which tells us about the kidney function. And then we have the partial pressure of oxygen, which tells us about oxygen level, and saturation pressure of oxygen, which tells us about oxygen saturation. ABGs give us a snapshot of the patient's acid-base status. That's number one. It also tells us about ventilation, and also it tells us about oxygenation. Now let's take a look at the ABG parameters and see their normal levels. We have the pH, which is regulated to be between 7.35 to 7.45. So any level above 7.45 is alkalosis, and any value below 7.35 is acidosis. And we also have the partial pressure of carbon dioxide, which level is from 35 to 45 millimeter mercury. And then we have the bicarbonate level, which is regulated to be within 22 to 26 milli equivalent per liter. So any value that is higher than 26 milli equivalent per liter is seen as alkalosis, while the values that are below 22 milli equivalent per liter are seen as acidosis. We also have the partial pressure of oxygen, and the value ranges from 80 to 100 millimeter mercury. And then the saturation pressure of oxygen, which is from 95 to 100%. So if there is any reading that is below 95%, it shows that this patient is having poor oxygen saturation. So having known the parameters that are used in arterial blood gas, how do we analyze it? How do we tell what these results mean? So using this R.O.M.E method, I will teach you how you can classify acid-base imbalances, whether it is respiratory acidosis, respiratory alkalosis, metabolic acidosis, or metabolic acidosis. We're going to discuss all this using real-life examples in this video. So now we're going to use the R.O.M.E method, or the R.O.M.E method. And that method is your ABG compass. So let's look at it. It means respiratory means opposite. That is to say that in respiratory conditions, the parameters go in opposite direction, just as we can see an increase in pH and a fall in partial pressure of carbon dioxide, or a decrease in pH and an increase in partial pressure of carbon dioxide. So when we see that pH has increased and partial pressure of carbon dioxide has decreased, we can see that that patient is having respiratory alkalosis. Remember in our last video we said that carbon dioxide is related to lung function, while the bicarbonate is related to kidney function. On the other hand, we have the metabolic part of the R.O.M.E. The M.E. states that when there are metabolic problems, the parameters are equal. That is, they go in the same direction. For example, pH and bicarbonate levels will either fall and rise together. There is no difference between them. Now we are going to look into the 6-step ABG interpretation. So work with me as we do that. The first thing you are going to do when you see any ABG result is first you check the pH. Is the pH high? Is it low? Or is it within the normal limits? Then the second thing you want to do is to check the partial pressure of carbon dioxide. And as you all know, the partial pressure of carbon dioxide tells us about the lung function. And after that, you look at the bicarbonate levels, because this bicarbonate levels tells us about the metabolism. So we are going to look at that. That is the third step. After analyzing the partial pressure of carbon dioxide and the bicarbonate levels, the next thing you want to do is to match the pH with the abnormal value. So if the pH is abnormal and the partial pressure of carbon dioxide is also abnormal, it means that it is a respiratory issue. And if the pH and bicarbonate levels are abnormal, it tells us that it is a metabolic issue. By this, we have classified it. And then the next thing you want to do is to check for compensation. Now, If there is metabolic acidosis, the lungs will try to compensate immediately for the problem. So the lungs tries to reduce this acidosis by blowing off excess carbon dioxide, so they don't come into the blood and react with water in the plasma to form more acid. So that is what the compensation is all about. The sixth step you want to look into is assessing oxygenation, which is the partial pressure of oxygen and the saturation level of oxygen. Remember we said that ABGs look at the pH, the lung function, the kidney function, and also the oxygenation level. So that is why we are checking for partial pressure of oxygen and saturation of oxygen. So with this, we are going to dive into real life patient scenarios. This is what will help us understand this phenomenon better. For the first scenario, we have Mr. T, who is a 68-year-old man, and he comes into the emergency room with shortness of breath, and he has a long history of chronic obstructive pulmonary disease. So as a nurse, the first thing we did was to check his vital signs, and it reveals that the respiratory rate was 10 and the SpO2 was 89% on air. And then the doctor orders for arterial blood gas analysis, and the result came out that the pH is 7.28, the partial pressure of carbon dioxide is 55 millimeter mercury, and the level of bicarbonate is normal. So let's analyze this result and see what this patient is going through. From the values we stated above, we have it that the pH is low. Therefore, it is established that this patient is having acidosis. But what is the origin? Is it a respiratory or metabolic acidosis? That will lead us to the next parameter, which is the partial pressure of carbon dioxide. And from the value we have, it is evident that the partial pressure of carbon dioxide is high. You remember when we began this video, we said that partial pressure of carbon dioxide tells us about respiratory function. So since the partial pressure of carbon dioxide is high, it is a respiratory acidosis. Remember the R.O.M.E method, everything goes in opposite direction. That is the pH and the partial pressure of carbon dioxide. Look at it, the pH falls while the partial pressure of carbon dioxide rises. Now we have to look at the bicarbonate level. They told us that the bicarbonate level is normal. That is to say that there is no compensation yet. So the diagnosis of this patient will be uncompensated respiratory acidosis. Now let's dive into the second scenario that we have for today. We have Sarah, a 17-year-old teen that presents to the clinic with rapid breathing after a panic attack. Her respiratory rate is 34 counts per minute and her heart rate is 120 beats per minute with no other symptom. Therefore, we took her blood to the laboratory to do some arterial blood gas analysis. The result came out that the pH was 7.49 and the partial pressure of carbon dioxide is 30 millimeter mercury. And the bicarbonate level is normal. So what is the problem with this young girl? Let's interpret it. From what we saw in the pH, we have it that the pH is high. That means alkalosis. And then looking at the partial pressure of carbon dioxide, it is very low. It shows that the lungs are blowing off carbon dioxide. That means she's having respiratory alkalosis. But then we also have the bicarbonate level that is normal. It tells us that this respiratory alkalosis is not yet compensated. So we say this lady is having uncompensated respiratory alkalosis. For compensation to occur, the kidney will try to retain hydrogen ions. So if the hydrogen ion combines with the bicarbonate, it's going to give us carbonic acid. Thereby reducing the bicarbonate levels in the blood, you see that there is a compensation. And when this compensation happens, you will find out that the pH will begin to fall to a normal range. And after the compensation, there will be pH balance in that lady's body. So let's head over to the third scenario. We have Mr. C, who is a 25-year-old man and has type 1 diabetes. and it presents with vomiting, deep rapid breathing, that's also known as Kussmaul respiration, and a fruity breath odor. Seeing his symptoms, we took his blood sample to the laboratory for analysis, and it reveals that the pH of his arterial blood is 7.31, and the partial pressure of carbon dioxide is 30 mmHg, and the bicarbonate level is 16 milliequivalent per liter. So what are we going to do with these results? We are going to analyze it to see what kind of imbalance this patient is having. Remember the R.O.M.E method. In metabolic imbalances, the parameters are equal. That is to say that they either rise or fall together. So from the arterial blood gas analysis we did, we have it that the pH is low. That is to say that this patient is having acidosis. Now going over to the bicarbonate level, we have it that the bicarbonate level is low. So low pH, low bicarbonate level. The two parameters are coming down at the same time. It tells us that this patient is having metabolic acidosis. But then we have gone to the partial pressure of carbon dioxide, and we find that is also low. That is to say that the lungs have started compensating for this acidosis. Here is what happens. The lungs tries to make the blood alkaline by increasing the respiratory rate. So when the patient breathes faster, he exhales more carbon dioxide. That is why the partial pressure of carbon dioxide is low. So his medical diagnosis now will become partially compensated metabolic acidosis. So in this case, there is partial compensation. The fourth scenario we have here is Mrs. A. She had a surgery 3 days ago and she has been vomiting for 2 days and now feels weak and dizzy. So having seen her symptoms, we did arterial blood gas analysis, and the results came out that the pH is 7.45 and the partial pressure of carbon dioxide is 47 mmHg. And then going over to the bicarbonate level, we have it that the bicarbonate level is 30 milliequivalent per liter. So let's analyze it and see what it means. The pH is high. From the normal values we gave earlier, it is evident that this patient is having high pH. So that is telling us that she is having alkalosis. Looking at her bicarbonate level, it is also high. Remember, in the R.O.M.E method, when talking about metabolic problems, it is equal. That is to say that the pH and bicarbonate level either rise together or fall together. So in this case, pH and bicarbonate levels are high. That is to say that this alkalosis is of the metabolic cause. So she's having metabolic alkalosis. Now let's check for compensation. We have seen that the partial pressure of carbon dioxide is slightly elevated. This is to say that her lungs are trying to retain carbon dioxide by reducing the respiratory rate. So in this case, this woman is having partially compensated metabolic alkalosis. This is what happened in this woman's case. The vomiting had led to loss of hydrogen ions, and because there's loss of hydrogen ions, acidity is lost. Therefore, it led to metabolic alkalosis. Alright, now you've seen how ABG analysis connects to real patients. It should start making sense to you now. If you like this video, do well to click on the like button and subscribe. Don't forget to turn on the notification button so you'll be among the first people to receive a notification when there's a new upload. I'll also leave a quiz in the description box so that we can try our understanding. And don't forget to drop your answer in the comment section. Until then, keep learning, keep caring. Bye.